Welcome to the Rehabilitation Following Concussion capsule. My name is Catherine Schneider and I'm a physiotherapist and researcher at the Sport Injury Prevention Research Centre at the University of Calgary in Calgary, Alberta, Canada. In this presentation, I will discuss the concepts related to the physiotherapy management of concussion. The objectives of this module are to summarize the evidence on rehabilitation following concussion, describe cervical spine treatment that may be used following concussion, and vestibular rehabilitation techniques that may be used following concussion. Concussion is a heterogeneous injury. Many different types of symptoms may persist and might require different types of treatment. Throughout this module, you'll hear in different capsules about the different types of treatment. In this module, we'll speak specifically about cervical and vestibular rehabilitation. When we summarize the research evidence, we find that there is evidence for a few different types of treatment from a rehab standpoint. The research supports cervico-vestibular rehabilitation, low-level aerobic exercise, and collaborative care. This capsule will describe cervico-vestibular rehabilitation. Our research and the research of others has found that neck and balance problems are common following concussion. Problems with the cervical spine can predict who may take longer to recover following a concussion. Similarly, there's research that suggests that people that have problems with their vestibulo-ocular reflex system, or the reflex that helps keep your eyes focused on a target when you're moving your head, may also predict who takes longer to recover following a concussion. A multifaceted examination that includes screening the neck and the vestibular and balance systems can help to determine if this type of treatment might help facilitate recovery following concussion. It's important to recognize that there are many different types of headaches, many of which require medical management, while cervicogenic headache may respond well to physiotherapy management, including manual therapy and exercises. You can refer to the capsule on headache management for more information. Similarly, there are different types of dizziness and balance problems that can occur following a concussion, some of which require medical management and follow-up with a physician, and others that might respond well to physiotherapy treatment. Thus, an assessment by a practitioner who is experienced in the assessment and management of headaches, dizziness, and balance is imperative to direct treatment appropriately. Neck pain is also common following concussion, and assessment of the neck and all of the different areas in the cervical spine that might be involved is important. The sensory systems all work together to keep the body upright in space and to coordinate head and neck movement with the eyes. This is a very complex process. An assessment of the cervical spine, vestibular systems, visual systems, and how well these systems work and are functioning together will give the healthcare professional information on what components are affected and what areas may require targeted treatment. The head sits on top of the neck, and it is possible that the neck can also be injured at the same time as a concussion occurs. However, just because someone has neck pain does not mean that they do not have a concussion. In many cases, the neck can be injured at the same time as a concussion occurs. This is important to recognize, as oftentimes neck treatment and concussion treatment can occur simultaneously. There are many different structures in the neck that could be a source of neck pain, including the joints, nerves, muscles, and others. In some cases, individuals have difficulty moving their head and neck in a coordinated way. Thus, an assessment should include a series of tests that look at different functions of the neck to ensure a complete picture of the type of problems that are present is done. In a study that we performed in elite youth ice hockey players, we found that performance on a series of tests that looked at how the neck functioned was significantly worse following a concussion. A physiotherapist or physician with expertise in assessing the neck can help to determine the most appropriate course of care. From a vestibular standpoint and balance standpoint, a detailed assessment of these systems by a healthcare professional with expertise in evaluation of the vestibular system can also help inform the assessment of concussion and assist in directing care appropriately. Proper orientation in space occurs through integration of input from your proprioceptive system, your visual system, and your vestibular system. This information comes into the brain and then output is sent to change one's position in space. Normally, all of these different sources give the brain consistent information and they work together in a coordinated fashion. If inaccurate information is coming in or out from one of these sources, or if the brain is having difficulty processing this information, dizziness and unsteadiness may occur. There are two main functions of the vestibular system. One is to maintain an upright position of the body in space. The second is to maintain the eyes on a target when your head is moving, called your vestibulo-ocular reflex. Assessment using multiple different tests helps to determine what the best course of treatment is and the source of potential symptoms. In some cases, medical management and follow-up with a physician with expertise in this area is warranted, and in other cases, individualized physiotherapy treatment might be of benefit. From a rehabilitation standpoint, we have done some research to evaluate combining treating the cervical spine and vestibular systems. For individuals that have ongoing neck pain, headaches, and dizziness or balance problems, a combination of physiotherapy aimed at treating the neck and balance systems may be of benefit. We have found in athletes that have suffered a sport-related concussion and have ongoing symptoms of dizziness, neck pain, and/or headaches, who were treated with a combination of treating the neck and balance systems, were nearly 4 times more likely to be medically cleared to return to sport than the individuals who continued to rest until their symptoms were gone. You might wonder what types of treatment might be included with this type of rehabilitation. Cervicovestibular rehabilitation is a type of treatment that includes individualized components based on each person's specific difficulties. In many cases, head-on-neck control or working on retraining the way that the body's controlling that head-on-neck motion, exercises that coordinate head and neck movement with the eyes are often included. Manual therapy is sometimes required, but not in the majority of cases. Soft tissue techniques that can help with some of the ongoing tightness in some of the muscles is also often included. Exercises that work on training the reflexes between the ears and the eyes so that you can better keep your eyes focused on a target with head motion is also included. Adaptation exercises are exercises that train the vestibulo-ocular reflex by looking at a target and turning the head while focusing on a target. Habituation exercises are repeating movements that cause some dizziness, and gradually the brain adapts over time to become less and less sensitive to that type of movement. Standing balance exercises to work on upright orientation in space while closing the eyes, working on one leg, narrowed base of support, etc. can also be included. Dynamic balance includes a variety of different head movements and body movements to gradually increase the difficulty of the type of exercise that one is performing. Eventually progressing to sport-specific training drills and adding additional concentration type activities to more simulate the typical environment that an individual might return to from a sport, work, or school environment can also be included, depending on the specific environment to which the person is returning. Some of our research has also shown that this type of treatment might be more effective if we initiate it earlier. However, more research is needed. From a key message standpoint, it's important to recognize that ongoing symptoms of dizziness, neck pain, and headaches are common following concussion, and that the neck and balance systems can be affected and may require treatment. Assessment by a healthcare professional with expertise in the assessment and management of the cervical spine and vestibular and balance systems is important to guide treatment appropriately. An individualized program of cervicovestibular rehabilitation has been found to facilitate recovery following concussion for individuals that have symptoms ongoing. It's important to work with someone who has specific expertise in these areas. It's also important to recognize that oftentimes these aren't the only symptoms that persist, so taking a holistic view at other areas that might also require management is important.